today I will explain you one interesting naming viruses, that is human boca virus. So human boca virus, that is HBOV, is a virus that commonly affects your respiratory tract and especially in infants and young children. Human boca virus belongs to Parvovirus family and was first discovered in 2005. The name boca virus comes from similarity to its bovine, that is cow, and canine, that is dog, parvoviruses. Okay, the causative agent of human boca virus is a small non-enveloped single-stranded DNA viruses. 4 types have been identified till now, that is HBOV1 mainly respiratory infection, HBOV2, HBOV3, HBOV4 mainly the GI tract infection. So now we will see the mode of transmission of this virus, how this virus spreads through. This virus spreads to mainly the respiratory droplets like coughing and sneezing and close contact with the infectious individuals, and it is also transmitted to the contaminated surfaces and hands like children in daycare, schools and various coaching centers are particularly susceptible to this virus. Clinical features: symptoms are similar to those the common cold and other respiratory conditions or infections. So in upper respiratory tract there is fever, runny noses, cough and sneezing, nasal congestion, sore throat, etc. In lower respiratory tract symptoms: wheezing, bronchiolitis, pneumonia, difficulty in breathing. In GI tract there is nausea, vomiting and abdominal pain. So how we can diagnose this virus infection? Usually the clinical examination only, but there is one more test, that is PCR, that is polymerase chain reaction test in respiratory samples. So we can also see the chest x-rays, maybe used in severe respiratory cases. Treatment: there is no specific treatment for this infection up till now, but for management we can use adequate hydration, rest, antipyretic drugs for fever and oxygen therapy if required. Hospitalization in severe respiratory disease may occur. So why we are learning this human boca virus? Because we are also part of the management of this virus. So physiotherapists like us can play important role in patients with respiratory complications. How? By positioning to improve their ventilations, breathing exercise. As we know, there are so many breathing exercises. Airway clearance like sputum techniques, sputum secretion technique, we can cover it. Early mobilization in hospitalized patients. Goals is to improve only oxygenation and reduce work of breathing, prevent complications such as atelectasis. Atelectasis means the collapsing of lungs. So it enhances the recovery and patients can recover from the respiratory infections. So prevention: frequent hand washing is necessary. Respiratory hygiene: while coughing and sneezing, you should cover your mouth. Cleaning contaminated surfaces, avoiding close contact with the individual which are suffering from this virus. Currently no vaccine is available for human boca virus. So the conclusion is that we need to be hygiene, we need to take care of our hygiene. We should not go to close contact with the person who is suffering with these things. And this virus is giving us so common symptoms that we could not recognize that this patient is suffering from this virus. Okay, so as the role of physiotherapy, it is important in supporting these patients while they are suffering from these infections. Thank you so much.